Welcome back, everyone. So it's Tuesday. You know what that means?
It's the day after Monday?
Well, yes, Danny, that is correct. But it's quickly becoming one of my favorite days of the week because of this lady right here, Dr. Tess.
Hello, lady.
Hi.
Dr. Tess. And it's Tuesdays with Dr. Tess, who treats A-list celebrities but has beauty tips for all of us. And Dr. Tess, today we're talking hair loss.
This is true. This is a real concern for men and women. So what are we doing today?
Well, millions of Americans suffer from hair loss. And if you're one of those suffering, there's really, very few options. Either you're doing topical treatments or expensive hair transplantation. Until now, we are at the age of regenerative medicine, and what we're going to talk about is really cutting edge.
What is it called?
Yes.
We can't wait.
Yes, it's ALMI hair, and it's utilizing the patient's own stem cells and growth factors from fat and blood.
I was going to say, so how does it work?
Yes,
but I think you kind of just explained it.
Exactly. So essentially, it's under local anesthesia, a simple clinic procedure. I'm harvesting fat under essentially lipo, a little bit of lipo, and then we process that fat, and you can see here, there's that fat that's not micronized.
Where does it come from?
Comes from someone's hip.
So it's your own fat.
Yes, and you can see this is the ALMI fat, and it's gone through some processing, so it's smooth, it's homogenized, and it actually can be injected using tiny needles, the same ones we use with a filler. So then we can inject that product that is rich with stem cells, growth factors in the scalp, and then within a few months, patients can see amazing results.
What about it works? Like, why are you taking it out of yourself? Like, what is the benefit of doing that?
This is the whole amazing thing about regenerative.
You're doing it right now.
Right here.
Oh,
so
my
we're
goodness.
injecting the ALMI product, again, fat from patient that is rich in stem cells, and growth factors is injected back where we need to grow new hair.
And how many procedures do you need to do?
Well,
to see
most patients after one treatment, and you'll see that in the before and afters, after a single treatment, we can improve hair.
Wow.
So how many treatments is this?
This is just one. This is very common for women. Female pattern alopecia, where there's thinning in the frontal hairline and widening of the part, and now you see more scalp. And this is at about 6 months. You can see so much more hair coverage. The part is barely visible. This is life-changing for these patients because, as you know, with women, right, our hair really equates to self-confidence, feeling sexy, and about 30 million women suffer from hair loss.
Yeah, and this is a man who went through this same process right here?
This is a man. This is actually a man in his 20s, and you can see before significant hair loss. About 25% of men under the age of 30 suffer hair loss like this. And you can see 1 year after a single ALMI hair procedure and platelet-rich plasma treatment, significant improvement in his crown, his frontal hairline. It's amazing.
So let's talk price. How much does something like this cost?
Again, this is only a fraction of how much people spend in a surgical hair transplantation. So you're looking about $4,500, $5,500, depending on how many platelet-rich plasma treatments are included in a series. But again, there's never been this type of hope for people with hair loss before. And again, over 300 million people in America suffer from hair loss, both men and women, and we now have new hope for all of them.
And what about pain? Is it painful?
Well,
I'm always about the pain.
Yes. Actually, I've had this procedure done, and we now have amazing technologies to really deal with making this procedure as comfortable as possible. We have Pronox nitrous gas anesthesia. We also can do nerve blocks. So it really is tolerable. Most patients are pleasantly surprised at how easy and painless, and of course, it's worth it.
And talk about your patients, how they feel emotionally, because I know losing your hair, it hurts your self-esteem.
Oh, absolutely. There's studies that show that people would rather have more hair than have more money.
Wow.
And 73% would give up something treasured to them, and if they know they're going to get hair. So it is really connected to our self-esteem, our self-confidence, and about 50% of women after the age of 50 experience hair loss and suffer from hair loss. And in the past, there hasn't been any good treatment. But now with ALMI hair, platelet-rich plasma treatment, there's new hope.
Yeah. Well, thank you so much. You always bring the good stuff here.
Yeah, we will see you next Tuesday.
Yes.
Look forward to it.
Coming up, get on your feet at home, everybody.
Brooke Burke is back to put us all through what she calls her 2-minute tune-up.
And it's all happening next, right here on California Live.